This video introduces Wilson disease and displays a real case study of a patient from initial symptom presentation to stable disease management. Wilson disease is a rare genetic disorder in which impaired copper excretion from the liver causes excess copper accumulation. If untreated, the disease can be disabling and can ultimately lead to liver transplantation or death. Over time, elevated copper levels can damage organs throughout the body, as shown in the diagram on the left. Patients with Wilson disease typically present with hepatic, neurologic, or psychiatric disease, or a combination of these. For example, the case presented in this video will describe a patient whose delayed diagnosis of her Wilson disease caused severe neurologic disability. Patients may present with variable symptoms that are not specific to Wilson disease, and that often lead to misdiagnoses or delays in diagnosis. Early diagnosis and treatment of Wilson disease is critical for limiting disease progression and improving patient outcomes. This case study follows a 37-year-old female patient who initially presented with symptoms in 2016. In 2019, the patient was diagnosed and treated for Parkinson's disease. However, this diagnosis should have raised suspicion because Parkinson's disease is rare in people her age. In 2020, when the patient's symptoms continued to worsen, new assessments and referral to the right specialist led to the correct diagnosis of Wilson disease, and an appropriate treatment was initiated. 6 months after starting treatment for Wilson disease, the patient continued to deteriorate. The video clip shows the severity of her neurological symptoms. In some cases, symptoms can be managed by adjusting treatment doses. However, this patient's neurological worsening prompted a switch to a different treatment for Wilson disease. As seen in this video clip, the patient showed symptom improvement 6 months after switching treatment. Her tremors and depression improved. She became more independent, and her exchangeable copper values were within the normal range. 26 months after switching Wilson disease treatment, the patient was asymptomatic. At this time, the patient could walk and function independently. One of the key learnings of this case study is that misdiagnoses can lead to delays in appropriate treatment and disease progression. It is also important to refer patients to appropriate clinical specialists. For example, the patient here was correctly diagnosed after being referred to a neurologist who specializes in movement disorders. Additionally, regular monitoring helped identify worsening neurological symptoms, despite treatment for Wilson disease. In fact, 10 to 50% of patients may experience severe neurological worsening after starting certain types of treatment. In this case, the patient benefited from switching to a different treatment for Wilson disease. Wilson disease requires lifelong management. As this case study shows, choosing the most appropriate treatment may improve patient outcomes, and remaining on therapy is important for patient success. Early and accurate diagnosis, referral to the right specialist, appropriate treatment, and frequent monitoring are critical for patients with Wilson disease. Scan the QR code on the screen to learn more.